Is surgery your only option for bunion relief? Not always. In fact, many people with bunions can find significant relief and prevent progression using conservative treatments that don't involve any cutting, screws, or lengthy recovery periods. But here's what most people get wrong about bunion care. They think that conservative treatments will make their bunion disappear completely, or they assume these treatments are just temporary band-aids that don't really help. The truth is somewhere in between, and understanding this can make all the difference in your treatment success. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas. Over my 25 years of practice, I've helped thousands of patients find relief from bunion pain using non-surgical treatments. And today, I'm going to share exactly what works, when it works, and what you can realistically expect from conservative bunion care. In our previous modules, we covered what bunions are and how they affect your daily life. Today, we're diving deep into the non-surgical solutions that can help you get back to comfortable walking, better shoe fitting, and the activities you've been avoiding. Before we start, please like this video and subscribe with the notification bell on. This helps others find the treatment options when they need them most. And grab your free copy of my comprehensive bunion book at www.bunionbook.com. It covers everything we're discussing today and much more. Let me start by setting realistic expectations about what conservative bunion treatment can and cannot do. This is crucial because having the right expectations will determine whether you're satisfied with your result. Conservative treatments will not make your bunion disappear. The structural changes that create the characteristic bump and toe deviation, those don't reverse with non-surgical care. If someone promises you that exercises, splints, or other special devices will eliminate your bunion completely, they're not being honest with you. However, what conservative treatments can do is often life-changing for my patients. They can significantly reduce or eliminate bunion pain. They can slow or stop the progression of the deformity. They can help you get back into shoes that you thought you'd never wear again. And they can allow you to return to activities you've been avoiding because of your bunion discomfort. The goal of conservative bunion care is relief and control, relieving your current symptoms and controlling future progression. For many people, this is exactly what they need to get back to living their lives without constant foot pain and limitations. Think of it this way. If you have high blood pressure, medication doesn't cure the underlying tendency towards high blood pressure, but it controls it effectively and prevents serious complications. Conservative bunion treatments work similarly. They manage the condition and prevent it from getting worse while providing significant symptom relief. Now let's dive into the specific non-surgical treatments that can make a real difference in your bunion symptoms and quality of life. Custom orthotics are, in my experience, the most effective conservative treatment for bunions. But let me be clear about what I mean by custom orthotics. These are not the generic insoles you can buy at the pharmacy or online. Those might provide some cushioning, but they don't address the specific biomechanical issues that contribute to bunion formation and progression. True custom orthotics are prescription medical devices made specifically for your feet based on a detailed examination, precise measurements, and often a cast or digital scan of your feet. They're designed to address your individual foot mechanics and specific forces that are causing your bunion problems. Here's how custom orthotics help with bunions. They control abnormal foot motion and that puts stress on the big toe joint. When your foot moves properly during walking, the forces are distributed evenly across all your joints. But when you have the foot mechanics that predispose you to bunions, excessive forces can get concentrated on your big toe joint with every step. Custom orthotics redistribute these forces by supporting your arch, controlling excessive pronation, and helping your foot maintain better alignment throughout your walking cycle. This takes pressure off the bunion and can significantly reduce pain and inflammation. Many of my patients notice improvement within the first few weeks of wearing custom orthotics. The daily aching and throbbing often decreases dramatically. Shoes that were becoming uncomfortable become wearable again. And most importantly, the progression of the bunion often slows or stops entirely. The process of getting a custom orthotic involves a comprehensive biomechanical examination. I'll assess your foot structure, joint mobility, and muscle function. We'll analyze how you walk and identify any abnormal motion patterns, and then we'll take precise impressions of your feet and send them to a specialized lab with a detailed prescription for your specific needs. Custom orthotics typically last several years with proper care, making them a cost-effective long-term solution. Many insurance plans cover them when they're medically necessary for conditions like bunions. Proper footwear is absolutely crucial for bunion management, but most people don't know what to look for in bunion-friendly shoes. The wrong shoes can make your bunion worse, while the right shoes can provide significant relief and help prevent progression. The most important feature is a wide, deep toe box that doesn't compress your bunion against the side of the shoe. Your toes should have room to move naturally without being squeezed together. The shoe should be made of soft, flexible material and accommodate the shape of your foot, rather than forcing your foot to conform to the shoe. Avoid pointed toe shoes, which force your big toe towards your second toe and increase the deforming forces of the bunion. High heels are also problematic because they shift your body weight forward onto the ball of your foot, increasing pressure on the big toe joint. Look for shoes with a good arch support and cushioned soles that help absorb shock and reduce impact on your joints. Lace-up or adjustable strap shoes are often better than slip-ons because then they can allow you to customize the fit and provide better support. Some shoe brands are particularly good for people with bunions. Companies like New Balance, Brooks, and Asics make athletic shoes with wide toe boxes and good support. For dress shoes, brands like Clark's, Echo, and Naturalizer often have styles that accommodate bunions while still looking professional. Sometimes, simple modifications to shoes you already own can make them more comfortable. A shoe can be stretched in specific areas to accommodate your bunion. You can also use home stretching devices, though professional stretching usually gives better results. Adding cushion insoles or metatarsal pads can help redistribute the pressure that improve comfort. Just remember that these generic additions work best in combination with properly fitting shoes, not as a way to make poorly fitting shoes tolerable. Physical therapy may not be the first thing you think of for bunion treatment, but it can be surprisingly effective, especially when combined with other conservative measures. The goal isn't to reverse the bunion deformity, but to improve foot and ankle function, reduce pain, and help prevent secondary problems. A physical therapist who specializes in foot and ankle conditions can help teach you specific exercises to maintain joint mobility in your big toe. Bunions often lead to stiffness in the big toe joint, which can worsen pain and affect your walking pattern. Gentle range of motion exercises can help maintain flexibility and reduce stiffness. Strengthening exercises for the small muscles in your feet can also be beneficial. These intrinsic foot muscles help support your arch and maintain proper toe alignment. While strengthening these muscles won't reverse a bunion, it can help improve overall foot function and reduce some of the compensatory problems that develop. Calf stretching is particularly important for people with bunions. Tight calf muscles can contribute to the abnormal foot mechanics that worsens bunions. Regular stretching can help improve your foot's ability to function normally during walking. Physical therapy can also address any secondary problems that have developed because of your bunion. If you've been walking differently to avoid bunion pain, you might have developed tightness or weakness in other areas. A skilled therapist can identify and address these compensatory issues. Night splints and toe spacers are popular conservative treatments, and while they're not miracle cures, they can provide some benefit in certain situations. Let me explain what they can and can't do. Night splints are devices that hold your big toe in a more normal position while you sleep. The theory is that this helps stretch the soft tissue that have contracted around the bunion and may slow the progression of the deformity. Some people find that wearing a night splint reduces morning stiffness and pain. However, it's important to have realistic expectations. Night splints work on the soft tissue around the joint, not on the bone deformity itself. They may provide some symptom relief and possibly show slow progression in the very early bunions, but they won't reverse an established deformity. Toe spacers work by separating your big toe from your second toe. which can reduce pressure and friction between the toes. They're most helpful when your big toe is crowding your second toe and causing irritation or callus formation. Both night splints and toe spacers tend to be most effective in the early stage of bunion development when the deformity is still mild and flexible. They're also more likely to help with symptom relief than with actually changing the progression of the bunion. These devices are relatively inexpensive and have no significant risks, so they're worth trying if you have a mild bunion. Just don't expect dramatic changes, and don't let using the devices delay you from seeking more effective treatment if your symptoms are significant. Sometimes the most effective treatment for bunions involves modifying your activities rather than trying to treat the bunion itself. This doesn't mean giving up everything you enjoy, but rather making smart choices about how you approach different activities. If certain exercises or sports aggravate your bunion, consider modifications that reduce stress on the big toe joint. For example, if running causes bunion pain, you might switch to cycling or swimming for your cardio exercises. If you love hiking but your bunion hurts in hiking boots, you might choose shorter hikes or invest in custom orthotics that can make your boots more comfortable. Pay attention to the activities that consistently worsen your bunion symptoms and look for alternatives or modifications. Sometimes, simple changes in technique or equipment can make a big difference. Activity modifications also include being strategic about when you do certain activities. If you know that a long day of walking will aggravate your bunion, plan accordingly. Wear your most comfortable shoes, take breaks when possible, and have a plan for managing any increased symptoms afterwards. The key is finding a balance between staying active and not constantly aggravating your bunion. Complete activity avoidance usually isn't necessary, but some thoughtful modifications can significantly improve your comfort. Conservative treatments work best for certain types of bunions and certain types of patients. Understanding when these treatments are most likely to be successful can help you make informed decisions about your bunion care. Non-surgical treatments are most effective for mild to moderate bunions where there isn't significant joint damage or arthritis. If your bunion is still reasonably flexible and the joint surfaces are in good condition, conservative treatments have the best chance of providing meaningful relief. These treatments also work best for patients whose primary goals are pain relief and preventing progression rather than cosmetic improvement. If your main concern is how your bunion looks rather than how it feels or functions, conservative treatments might not meet your expectations. Patients who are motivated to make lifestyle changes, wearing appropriate shoes, using orthotics consistently, doing prescribed exercises, tend to have better outcomes with conservative care. These treatments require some commitment and consistency to be effective. Conservative treatments are also ideal for patients who want to avoid surgery due to medical conditions, work requirements, or personal preference. Many people can achieve their functional goals without ever needing surgical intervention. However, it's important to recognize when conservative treatments aren't providing adequate relief. If you've tried appropriate non-surgical treatments for several months without significant improvement, or if your bunion continues to progress despite conservative care, it may be time to consider surgical options. Signs that conservative treatment isn't enough include persistent, significant pain that interferes with daily activities, progressive worsening of the deformity despite treatment, development of secondary problems like severe hammer toes, or the inability to find any shoe that are comfortable. The key is not to wait so long that your bunion becomes severely deformed and rigid. Early surgical intervention, when indicated, typically has better outcomes than surgery on severely arthritic, rigid bunions. Conservative bunion treatments can be highly effective when used appropriately and when expectations are realistic. The goal is symptom relief and progression control, not elimination of the bunion deformity. For many patients, this level of improvement is exactly what they need to return to comfortable, active lives. Custom orthotics, proper footwear, physical therapy, and activity modification form the foundation of effective conservative bunion care. Night splints and toe spacers can provide additional benefit in some cases, particularly for mild, early bunions. The key to success with conservative treatment is consistency, patience, and working with a healthcare provider who understands bunion biomechanics and can guide you towards the most appropriate treatments for your specific situation. Before we wrap up today, I want to hear from you. Leave a comment below and tell me, which non-surgical treatment are you most curious to try? Are you interested in learning more about custom orthotics? Or do you have a question about finding the right shoes for your bunion? If this video helped you understand your conservative treatment options, please share it on social media. Someone you might know might be struggling with that bunion pain and not realize that there's effective non-surgical treatments that are available. Don't forget to get your free copy of my comprehensive bunion book at www.bunionbook.com. It provides detailed information about all the treatments we've discussed today and can help you make informed decisions about your bunion care. If you're ready to explore conservative treatment options for your bunion, don't wait for the problem to get worse. Early intervention gives you the best chance of success with non-surgical treatments. Schedule a consultation to discuss your options and develop a personalized treatment plan. The link is in the description below. Thanks for watching today's video. Make sure to subscribe and hit that notification bell so you won't miss our final video in the Bunions 101 series, when we'll cover everything you need to know about bunion surgery. We'll see you next time, and remember, you have more treatment options than you might think. Thanks so much for watching, and have a great day.